today in my 10th year, and every year we've had to go down, scrap, fight, and advocate for what we know is right, which is getting resources back to Roseland Community Hospital because it's done so much great work in the community. With that said, many of us know I chair the House Black Caucus as well, so I do a lot of work that's at the forefront of every social determinant of health. And when you think about Roseland, you think about the Black community. We're disproportionately impacted by everything. Every social determinant of health. Just in the second and third grade, we start to see those disparities within our children, right? When it comes to reading, writing, and math. Many of you know I chair the House Judiciary Criminal Committee, do a lot of public safety work. Black folks are 14% of the state's population, routinely over 50% in the Department of Corrections. And then, Commissioner, I don't know what it is in the Cook County Jail, but I think it's even higher when you talk about Cook County Jail. We're hearing about environmental health. We're hearing about economic development and the issues there, and we have to give it up to Roseland Hospital. It's an economic engine, over 500 employees at Roseland Hospital. So when you talk about, barely keeping it open, this is an economic driver, an economic engine for our community. And of course, we'd be remiss if we didn't talk about those social determinants of health as it relates to health, right? Hypertension, diabetes, strokes, for Black women, breast cancer, for Black men, prostate cancer. So we appreciate those specialty programs and services that Roseland has, sickle cell, the mammograms, I'm probably missing a few here, doing some stuff with mental health. These are all so critical to our city and to our state. We know that when we can help the most vulnerable, you're helping out comprehensively the entire state. And let me just say this, while you all's president is body slamming health and Medicaid, it becomes even more important that we not just have this breakfast today, but that our advocacy continues. We've got 1 month to go, right, Senator? 1 month in Springfield to land the plane on our budget, right? We need this group to show up in Springfield to advocate for these critical resources to keep Roseland Hospital open. I want to give a big shout out to Ben Lazar, who's on the policy legislative effort in this. Ben, raise your hand so people know who you are. We have several bills, especially those operational grants that Tim has been talking about, that we must fight for in terms of not just Roseland Hospital, other safety nets as well. Oftentimes, when you look at these hospitals, especially as it relates to Roseland, you're really in a hospital desert, pretty much, on the far south side of Chicago. I talked about the specialty care, but it's really just across the board in terms of what Roseland Hospital is able to provide to the community in a comprehensive way. And so we need you to get down to Springfield to advocate. The legislators need to hear from you. I think we're asking for about $300 million for safety net hospitals. It needs to be more. In right now, what did we bring in, Ben? About $120 million in this particular budget. That's got to be doubled. We just heard from our comptroller here. This is ridiculous that we have to fight to keep the doors open for an institution that is caring for the most vulnerable. It's not like Roseland doesn't have their stuff together. We have a 5-year plan. We also have a best practice that's on the horizon, the Roseland Medical District, right? Where we can create an ecosystem for the region to care for the most vulnerable. So it's important that we not just keep the doors open. Let's lift up Roseland as a best practice for community health throughout the country. The way we do that is by, advocating along with our partners, along with our stakeholders. We're hearing from every level of government, that's what it's gonna take, right? Your city, county, state, and the federal government to come together and to make sure that we are all putting our best foot forward for this great institution. So thank you so very much for everything that you do, Tim, all the workers at Roseland Hospital, and everything that you do for our community. Thank you so very much.